Well, good morning, afternoon, or evening to all everybody joining us. Thank you very much for joining us, and welcome to the ones listening to this webinar afterwards. I also would like to warmly welcome our guests today, who I'll introduce later. Today's webinar is titled "Mental Health Aspects of the Impact of Disaster and Emergency Situations." And to mark World Mental Health Day today, this event will explore the profound impact that diseases and emergency situations can have on mental health, affecting both individuals and communities, and often leading to long-term consequences. The sudden disruption, loss, and uncertainty caused by such events frequently triggers stress, anxiety, and fear. Survivors may experience grief, trauma, or post-traumatic stress disorders, and while first responders and healthcare workers can face burnout and compassion fatigue, as well as concerns for their own safety. And during crisis, access to mental health support is often limited, which makes resilience building, strong community support systems, and timely psychosocial interventions crucial for recovery and overall well-being. My name is Robert Moss. I'm a vice president for the FIP. I live in the Netherlands, and one of my liaison points in the bureau is the Humanitarian Response and Resilience in FIP. Before we start the webinar, we'll have to go through a few announcements. First, this webinar is being recorded and is live streamed via YouTube. We have an enormous amount of participants, over 3,000, and some of them will be redirected to YouTube directly already, but welcome, and it's great to see so many attendees. The recording will be available on our website later, and you may ask questions, but do this through the Q&A box provided. And because there are so many people, please refrain from saying too many greetings. It is really used for the Q&A. You are welcome to provide feedback later to webinars@fip.org, and we would really encourage you to become a member of our global community, to become a member of FIP. Then, for this webinar, there is a translation feature available on Zoom. To use it, turn on the captions, enable the translation toggle, and choose your preferred language. Then, the most important part, the speakers that will be presenting today. First, we will start with Vijay Supaya. Then we will have Kay Dunkley, Luna El-Baziri, and for joining us for the panel will be Saleh Kandil Subar. Today's program is in part 4 presentations. We will be going into the details later, and then we will have testimonials from humanitarian workers in Gaza and Sudan on audio file. After that, we will have a moderated discussion and audience, and we will look at the audience Q&As and help answer those questions. One of the reasons to have this webinar is because today is World Mental Health Day, the 10th of October 2025, so today. And this particular point that WHO is now sort of stressing is the mental health in humanitarian emergencies. So therefore, this webinar is very well suited to support the bigger picture that WHO is presenting, and we hope you enjoy it. Thank you. I'm sorry I just skipped the slides. We will be going through 3 presentations: mental illness in disasters and emergencies, risks and long-term consequences by Dr. Vijay Supaya. Then we will go to a lecture on building resilience and providing psychosocial support in pharmacy practice by Dr. Kay Dunkley from Australia. We will look at practical approaches for supporting mental health in pharmacy settings by Dr. Luna El-Baziri. And we will be listening to 2 testimonials from Gaza and Sudan. and later we will have the moderated discussion. The learning objectives for this webinar are to recognize the psychological and emotional impacts of disaster and emergencies, including stress, anxiety, grief, and trauma, understand the importance of timely psychosocial support and resilience building strategies for affected individuals and communities. And last but certainly not least, apply approaches to support mental health during and after crises, including self-care, community engagement, and referral to professional resources by pharmacists. Within FIP, there is a large program on non-communicable diseases. And part of the non-communicable diseases structure is the mental health part. And the mental health is one of the main areas inside the FIP NCD program. Pharmacists can contribute to the prevention, care, and management of mental health conditions and the stigma associated with them by supporting patients through different roles. Next slide, please. And to help pharmacists do this job or to do it better, the FIP has developed a handbook for pharmacists on mental health care. The handbook can be downloaded from the FIP site, and it aims to support pharmacy practice and presenting many potential mental health care actions that pharmacists can perform, from preventing mental illness and screening for signs to optimizing medication and responding to mental health crises. To complement the mental health care handbook, there is a knowledge and skills-based guide. This guide is a companion to the mental health care book and intends to provide an overview of the knowledge and skills needed for pharmacists to deliver mental health care services and care. And several other events are available on the FIP website. Another large part of the FIP is a program called the Humanitarian program. It is a program that is supporting all our member organizations and pharmacists in humanitarian situations. And as part of the Humanitarian program, FIP published several resources, including frameworks and guides, toolkits, and FIP commitments and policy statements that support pharmacists and the pharmacy profession in the humanitarian activities and the emergency settings. They can all be found at the dedicated microsite, FIP humanitarian.fip.org, and you can reach it by scanning the QR code. Another part of the Humanity RX is supporting local communities that are struck by a disaster or a conflict. And it is done by raising money, but first of all, connecting to local countries and local people in the disaster area, seeing what their needs are, and then in a crisis zone, countries that are around there to see how we can help in getting medication or other needs to the organizations. And this is done by charities that were supported financially. So we would like you to look at the website and see how you can contribute to the Medicines Too, in this case, Gaza and other Medicines Too initiatives. But that is enough for the introduction. Now it's about the real theme. So it's my great honor to introduce Frija Sapaya, talking about mental illness in disasters and emergencies, risks and long term. Thank you very much, Frija. The floor is yours.
Thank you, Robert, for the very kind introduction, and happy World Mental Health Day, everyone. Today's presentation will only concentrate on the mental health aspects of disasters and emergency situations. I do acknowledge the massive impact that disasters have on physical health as well. Before I start my presentation, I'd like to acknowledge the traditional owners of the Ghana people of the Adelaide Plains. I recognize and respect their cultural heritage, beliefs, and relationship with the land, and I acknowledge that they are of continuing importance to the Ghana people living today. And before we start looking at disasters, let's have a brief look at what constitutes a disaster. In broad terms, a disaster is a diverse set of events ranging from man-made activities such as terrorism and war to nature-caused events such as tsunami, earthquakes, and volcanic eruptions. Now, these are unexpected and uncontrollable events that can have major impact on people's personal, social, economical, and well-being aspects of their lives. Just concentrating on natural disasters, now these can be quite sudden and extreme weather events that can unfold within a very brief period of time. For example, minutes to hours, such as earthquakes, cyclones, or could be slow-paced events that can last for days or weeks, such as floods or wildfires. In recent years, climate change has increased the frequency and intensity of disasters globally. In 2020, for example, approximately 100 million people were affected by disasters worldwide, and this cost the global economy an estimated event of 190 billion US dollars. Now, just a year later, in 2021, that amount increased to 250 billion US dollars, with Asia being impacted most heavily, accounting for more than 66% of the total people affected. Many sudden onset natural disasters arrive with very little time to prepare, often inducing shock, confusion, and disorientation. Ongoing disasters like droughts and pandemics have the potential to create chronic patterns of disease, stress, anxiety, and depression. Some affected individuals experience trauma-related disease exposure, while others experience delayed onset of psychological impairments, and a small fraction of them will then go on to develop very serious mental health issues in the long run. Hence, the disaster impact can extend beyond its onset and last for extended periods. Now, we'll look at some of this longitudinal research later on in the presentation. This slide here, This slide here is a summary of studies that was published between January 2000 and May 2022. All of these papers investigated short to long-term health trajectories after disasters. Of the 234 published papers in this period, 82 reported on the impact of earthquakes, followed by 34 on hurricanes, 20 on tsunamis, and 18 on industrial disasters such as oil spill, ferry disasters, and so on. I can see that no part of the globe has been spared, but interestingly, no studies investigated the impact of extreme temperature or droughts, which are becoming more and more prevalent in various parts of the world. So experts have gone on to study communities that have experienced disasters and have put forth various theories to explain the relationship between disasters and its effect on mental health, both short-term and long-term. Now, we're going to look at some of these theoretical models. But before we do that, let's look at mental well-being. Now, as we all know, mental well-being not only depends on personal factors, but also on social environmental factors. Now, all of these factors interact with each other and together have an impact on people's mental health. Researchers have developed two broad models to try to explain the multiple influences a disaster can have on a person's mental well-being. Now, the first model is known as the stress reaction model. Now, this model focuses solely on the stress and psychological aspects of experiencing a disaster and is centered around PTSD, depression, and anxiety. The second model is the psychosocial model, which focuses on the role of social and environmental factors on mental health and the ways disasters disrupt these factors and their impact on mental well-being of people. In the stress reaction model, researchers have developed a 5-step process to explain how individuals react to the stress induced by a disaster. First, the stressful situation causes fear and worry about one's own health, financial or employment situation, and loss of reliable support services, and also the well-being of those close to them. Secondly, the distress causes symptomatic stress responses such as changes to eating patterns, sleeping difficulty, and use of substances to help them cope with the change. Third and fourth is more or less kind of related, which talks about the stressful situation which may either aggravate the onset of an existing mental problem or bring about the first-time episode of a psychological issue in those who are already predisposed either biologically or having a genetic vulnerability. And finally, it may cause stress-related problems such as PTSD, depression, anxiety disorder, or an adjustment disorder among those exposed to a disaster. Now, if you look at studies that looked at that have studied this particular model, PTSD is the most prevalent mental outcome of disasters, and the risk of developing PTSD following a disaster is associated with several well-studied protective and risk factors, and we'll look at some of these later on in the presentation. Now, the second model is the psychosocial model, and this proposes that the loss of social and personal resources results in reducing the capacity to cope and provokes a psychological distress. This model accounts for a range of adverse life events, such as loss of a house, financial adversity, and disrupted social support services on individual adjustments following a disaster, shifting the emphasis from a more direct effect of the disaster exposure. For instance, many natural disaster victims, particularly when provided adequate warning, might not be directly exposed to life-threatening or other horrific disease-related experiences. However, they may face a range of adversities during the post-disaster period, including food scarcity, damaged property, loss of employment, feelings of hopelessness, and disruption to normal routine. So both of these models kind of explain various aspects of what a disaster impacted community is going through. So understanding both of these models would greatly help people who are part of the supportive and recovery services. So when we talk about recovery, FEMA, that's the Federal Emergency Management Agency in the US, have proposed this model where disaster-affected communities are thought to progress through 6 phases during the recovery process. The pre-disaster phase includes warnings and threats related to the looming disaster, which helps people to prepare and make decisions around staying or evacuating from that area. During the disaster phase, various sub-events occur, such as displacement from their home, injury, or death of loved ones. And emphasis is placed on exerting control over what is currently occurring. After that, you see there's a heroic phase where it involves saving others, temporary relocation to a safer place, promoting safety and support from government and insurance agencies. Following that, there's a honeymoon period where external assistance remains and community bonding increases through a shared catastrophic experience. So survivors here, this level of emotion remains high, including being hopeful and believing that the help they receive will make them whole again. Now, the honeymoon phase may occur up to several months after the disaster, but the actual timing and length of this phase may vary. This phase is then followed by the disillusionment phase, characterized by disappointment. So disaster survivors get disillusioned because agencies and volunteers pull out of the assistance, and the community's hopes for restoration to pre-disaster wellness is typically unfulfilled. During this phase, community cohesion is weakened as individuals are more focused on trying to meet their unmet needs. Survivors may become exhausted due to growing multiple demands, including financial pressures, relocating or living in a damaged home, bureaucratic hassles, and the lack of free time for recreation or self-care. Mental problems and the exacerbation of pre-existing conditions emerge as a result of ongoing stress and fatigue. The important bit that happens at this time is the disaster anniversary. So the failure to address this experience can further demoralize survivors, exacerbate underlying psychological distress, and worsen the trajectory of community recovery. And finally, you've got the reconstruction phase, including short, medium, and long-term recovery. Now, this may begin a few days after the disaster, but can last up to several years depending on the severity of the disaster. Survivors attempt to restore their lives by rebuilding homes, returning to old jobs, finding new employment, and resuming or forming new social support systems. Some can accept their new circumstances, including the losses and changes, whereas others may instead focus on resentment and anger, identifying themselves as victims. Across all groups, common outcomes will include PTSD, depression, anxiety, and substance misuse. Now, these conditions can affect functioning and may increase the risk of suicide, although the prevalence of suicide may differ between groups. So in the acute phase, you've got bereavement, injury, loss of home and or livelihood. There's usually displacement from the place of livelihood and poverty, and all of these can worsen the vulnerability of predisposed individuals. Prior trauma or illness will increase the likelihood of long-term psychiatric disorders. Majority of individuals are resilient and recover as time passes. They may or may not end up achieving the levels pre-pandemic or pre-disaster. Some individuals can have a delayed onset of mental health symptoms. You see high levels of PTSD, depression. In a minority, especially those who have a predisposition, this can trigger and lead to chronic mental health issues. In the long term, you see chronic PTSD and depression. Children exposed may suffer intergenerational effects, extending the impact or the duration of the impact. Now, these graphs have been taken from the previous study where we looked at the summary of various studies that studied long-term effects of mental health impact of disasters. You can see that PTSD, here noted as PTSS, follows a steady trajectory downwards after the disaster. Depression shows a delayed downward trajectory almost after a year, then you can start seeing the slope coming down. And anxiety demonstrates a downward trajectory after 6 months. Now, interestingly, PTSD drops steadily even though it doesn't quite meet the level of the controls. The two depression lines are the furthest apart. So even though there's some level of recovery, but even after 24 months, the exposed group is still well higher than the control group at 6 months. Anxiety is the only one where recovery is seen quite swiftly with the overlap of the two lines after 2 years. Apart from survivors of disasters, we also have first responders and healthcare workers supporting these communities who might be affected by these events. We know from various studies that first responders often witness repeated severe trauma on recovery operations, repeated exposure to death and destruction. Now, in the long term, compared to the general population, first responders have shown higher rates of PTSD, substance misuse, and high levels of burnout. They're also at a much greater risk of suicide. Now, in the acute period, the second group, the healthcare workers, face unique stresses such as moral distress, resource shortages, and long hours. The COVID pandemic was a great example that highlighted how risk escalates during very large-scale emergencies. In the long term, consequences can include elevated levels of depression, anxiety, and PTSD. Moral injury from impossible ethical choices and compassion fatigue can erode well-being of both groups. These may contribute to workforce attrition and reduce care quality. Now, this slide lists some of the protective factors as well as risk factors. I'm not going to go through all of these, but these have been very well studied and have been associated with how people react to a disaster or an emergency. And these are my references, and with that, I am happy to conclude my talk. Thank you for the opportunity.
Well, thank you very much, Vijaya, for this very interesting presentation, and you're really giving a context on all the effects that disasters can have on people and what phases people can go through. And I think we'll be coming into what how healthcare professionals, pharmacists can have a role in all these different parts, but also, of course, what they will have themselves if they are part of the humanitarian situation. It's great, a very, very clear presentation. Thank you. Next, please let me introduce Dr. Kay Dunkley. She's the Executive Officer of the Pharmacist Support Service from Australia, and she will be talking about building resilience and providing psychosocial support in pharmacy practice. Kay, please, may I give you the floor?
Thank you. And I'll say good evening to everyone. In Melbourne, here in Australia, it is evening. So for me, it's the end of the day. For many of you, it's much earlier in the day. I'm going to be talking about resilience, and I'll be talking about resilience in us as individuals, also in our teams, as we are all members of a team in a pharmacy situation, but also how we can support our patients in developing their resilience. I thought I'd start by talking about what a definition of resilience is. What is resilience? And it is This is the American Psychological Association definition: the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioural flexibility and adjustments to external and internal demands. Now, I also like this second definition, and it talks about the ability to bounce back. And I think, to me, that's the key in resilience. It's being able to adapt and bounce back. I think it's important to understand that resilience is not toughness or being emotionally disconnected. In fact, emotional intelligence and empathy are needed to be resilient. It is a positive characteristic of teams, and that is beyond the sum of the individual's resilience within the team. It's the collective ability to adapt, solve problems, and maintain high performance despite adversity. Now, resilience can be learnt or taught, and it does change over time, and it is in our control. And generally, what we see in life is that with life experience, we become more resilient. And I think this is an important concept, that we must be very careful not to weaponize the word resilience and perhaps tell the younger generations, you're not resilient enough, because it actually does take life experience to develop resilience. Now, if a younger person is part of a team, they will develop resilience by being part of that team. I think that's really important to remember, because otherwise resilience can be seen as something that's it can be used as a weapon. So why do we need resilience as pharmacists? I think we need to remember that we're all exposed to workload pressures, to stress, difficult interactions, and human suffering in our daily work in healthcare settings. And this could be in the community pharmacy, where we have a range of people coming in to see us. Sometimes those people will bring their emotions to us, and we need to work with them, whether they're agitated and aggressive or whether they're distressed and perhaps teary. Also, in pharmacy, where every day we deal with life and death. In the hospital setting particularly, we're dealing with patient death, but also the joys of new life. We see young children who are unwell. Working in healthcare is quite a stressful environment. The other thing is, every day we need to make critical decisions and respond to challenging circumstances. This is part of being a pharmacist. And we may also, depending on our role, be exposed to trauma, disasters, and emergency situations in the pharmacy. For example, if you're a pharmacist working in an emergency department, you will see trauma every day. If you're, depending on where you're located, you may be exposed to natural disasters and violence and domestic violence. And, emergency departments, people can come into our pharmacies and they can be acutely unwell. It's not uncommon for pharmacies, particularly in the community, to experience people come in and collapse or needing, urgent assistance. And then, of course, we have a proportion of our pharmacists who work in environments where there's aggression and violence, political disruption, war, famine, and humanitarian crises. And so, to deal with this, we need to be able to manage our work as health professionals and still provide care to those who come to us for care despite adversity. So as individuals, this development of resilience is particularly important. Now, in Australia, we are very fortunate and we don't tend to have the political disruption or war or famine directly impacting on us. But we do have a number of natural disasters such as bushfires and floods. And in those situations, pharmacists are often involved in things like triage and acute care, emergency prescribing and supply of medication and medical supplies, and also the distribution logistics. We're also often the first point of contact, providing a degree of mental health support and often providing general public health advice. And these photographs are from the Australian bushfires, which were quite extensive just prior to COVID over the summer of, our summer is during December, January, and February. And so it was over that period there were widespread bushfires in different parts of Australia. And the pharmacy profession played a key role in supporting those affected communities. And often those communities were cut off and they were isolated. And the photos here are of a particular pharmacist who was he was on the coast of Australia, but access to this area was completely cut off by the bushfires. And he, even though he didn't have power or internet access, he still stayed open to service his community. So you can see him here working. He had to handwrite his labels. He didn't have access to any electricity, so he couldn't use his computer or his he didn't have the ability to take payment from anyone, and he just continued providing care and providing medicines despite this. And he also was available, for extended hours. And so the local population, some of whom were cut off, some of them were holiday makers in the area and they ran out of medications. There was also a need for, treatments such as eye washes and things like that for people who are affected by smoke. And of course, there was huge anxiety in the community. And yet he was a pharmacist who stayed there in his pharmacy without power, without internet, without all the usual tools of his trade, and provided care for his community. So this is, an example that I can give. Obviously, in war-torn countries, this is a common thing because, often in those and where there's a huge natural disaster affecting a large area, pharmacists will be doing this. So how do we actually build resilience in ourselves? And I'm going to keep this very practical. I really think that what I want to convey is what we can do as individuals. So one of the most important things is nurturing that positive outlook and keeping things in perspective and looking at the bigger picture. We also need to be very mindful of our self-care and self-compassion. So looking after ourselves. It's very easy when we're in a caring profession to actually push ourselves to our limits and not invest any time in our own self-care. And likewise, as high achievers, as pharmacists, we often are hard on ourselves and we don't show that self-compassion when things don't go well. So I think it's important that we prioritise this. It's putting that oxygen mask on first, looking after ourselves so we can look after others. The other thing that's important in building resilience is to increase our emotional intelligence. We need to understand ourselves and others. So we do this by reflecting on events, how we've interacted with others, how you've handled the individuals and also difficult experiences, and learn from each experience. We also need to be open to feedback from others and to actually seek it out. Having a mentor can be quite important. It's a good way to have someone to talk over your development and your progress. Building our community around us is really important. Having that community of support is important to our well-being, but it's also important to our ability to develop resilience in ourselves. And we also need to accept that, change is part of life and we need to adapt continuously. So there'll be times when we have to adapt very quickly because of a disaster, because of a crisis. But over our lifetimes, will be continual change. I mean, over each one of us, we've seen huge changes in things like communication, across the world. So, it's important to remember that it's an ongoing process. To be resilient, we also need to have purpose and goals in our lives, and we need to really focus on that and know why we're doing things, because that gives us the motivation to keep going when times are tough. And the other aspect of being resilient is to focus on what's in our control and let go of things that are outside our control. We need to really realize that the things we can control best is our response to a situation. We might not be able to control that situation. And so our response to it, and that is a sign of resilience, being able to manage our response to a difficult situation. It is very much, resilience is a leadership skill. And as pharmacists, we are leaders in our communities, and therefore it is, an important skill to be developing. Now, team resilience. And I do think that team resilience is probably more important in the pharmacy environment than individual resilience, because we are always a part of a team, and team resilience is going to be greater than the sum of the individual's resilience. So the things that are very important for building team resilience are fostering psychological safety. So that's a safe environment where people can express their views or speak up without fear of criticism. We also need to promote the concept of that shared ownership of stress, that it's not always up to an individual, that we need to support each other and help each other. I mentioned before that sense of purpose, and that's important for the team as well. Supportive leadership is key, and obviously leaders who have particular styles of leadership where they're open and welcoming of input from others is really important. So, a leader who accepts feedback, who's willing to listen to others and give every team member the chance to have input into decision making is really important to the development of that team in terms of resilience and its ability to function well. Also, for leaders, giving recognition and appreciation to team members is important, but even within the team, acknowledging each other is very important. And feedback should be provided honestly but compassionately. So we need to encourage each other, but also provide feedback about areas that need improving. There needs to be respect within the team. There needs to be good communication, and that comes back to the psychological safety. And the other aspect of resilience is having the resources that are needed by the team. Now, that can be adequate resources in terms of members of the team, but it can also be physical resources or access to them, which, can be challenging in a disaster situation. So effective teamwork is a defining feature of mentally healthy workplaces, and effective and resilient teams will problem solve. They'll respond well to challenges, and they'll provide important social support for the team members. So, psychosocial support, what is it? And this is important both within our team, but it's also important in what we're providing to our community. And it's a very holistic support for not just the medication needs of our community, but emotional, social, and psychological well-being of the individuals. And it includes things like social prescribing, where we might encourage someone who comes to us, for example, someone with diabetes, to join an exercise program. It's, that ability to direct people to do things, or assist people, not rather than direct, to participate in activities which will improve their well-being. The other aspect of psychosocial support is that non-judgmental listening ear and providing empathy. It's very powerful in terms of empowering other people, and we don't need specific training to do this. It occurs every day in community pharmacy. And in community pharmacy, we all have, people who come to us regularly and we build relationships with them. They tell us about what's happening in their lives. And that is about providing psychosocial support by getting to know the people and having a stronger than, just that, I suppose, than just supplying medications and giving health advice. It's that psychosocial support, and that's an important role for pharmacists. So after trauma, what sort of psychosocial support is required? I mean, practical support, and that was something that Vijay mentioned, it's important that people are encouraged to take time to process what's going on, to also limit their exposure to media coverage, because often that will be continuing to reinforce the disaster. And so by staying away from media coverage and focusing on resting, eating well, taking time out for relaxation is really important. It's important that we encourage people who come to us, but also for ourselves, to acknowledge what's going on and to do enjoyable things, to acknowledge small achievements. When people are still struggling 2 weeks or more after some event, and this might be a traumatic event like a car accident or a criminal event or a nasty fall or some sort of violent incident, generally in Australia, we would encourage people to seek professional help at that point. Now, if you're in a humanitarian crisis, that might not be possible. And that's when your psychosocial support is key. It's really important that people do not use substances to cope when they're in this situation after trauma, because that really just numbs them. It helps them, it enables them to avoid the stress that they're going through rather than dealing with it. And it intends to just, sort of cover it up, and it can create a lifelong problem. Now, with emotional support, individuals may or may not want to talk about what's happened and how they're feeling. We need to reassure them that it's normal to feel distressed, normal to be upset, and that feeling distressed is a natural part of coming to terms with what has happened. There are cultural differences in what sort of support people need, and we need to respect that. And as I said, some people may want to talk about the trauma they've experienced and other people may not want to talk about it, and we need to respond to that as individuals. The other aspect of psychosocial support, and this is, where we can play a big role as pharmacists, is just listening. Sometimes it can be hard to know what we want to say. We don't need to worry about saying the right thing. There's no right thing to say, but there are a few pointers. So try to be empathic, put yourself in their shoes, don't interrupt, but also don't start offering examples from your own life and talking about yourself. It's important you focus on them. Avoid offering simple reassurances such as, I know how you feel, or you'll be okay, because that trivializes what they're going through. Acknowledge their distress. Things like, it's really tough to go through something like this. This is a tough time. Or sometimes it's hard to see a light at the end of the tunnel. And you can ask them leading questions like, would it be helpful to talk about it? Or you've had a rough time, how are you going? You might ask how the event has impacted other people. How's your partner going? How's Sarah going? How's, checking in with the family. And it's important to show that we understand by rephrasing the information they've given you, so paraphrasing. But if they don't want to talk, we can still show your support by spending time with them, talking about other things and doing practical things to help. And let them be alone for a while if that's what they want, but encourage them to have company for some time every day. It's important that people who are going through trauma don't become isolated or cut themselves off. It's far better to be part of a community, even if they don't want to talk about it. People who are isolated will actually often end up in a worse position. I've got all these tips from Phoenix, Australia. That's a natural centre of excellence in post-traumatic mental health that's available in Australia. So the other just reminder before I close and hand over to the next speaker is it's really important that we look after ourselves. We can't pour from an empty cup. We need to, put on our own oxygen mask, and self-care has to be a regular part of our lives. It's not an emergency response, and it takes many forms, including exercise, nutrition, rest, hobbies, and other interests. It can be time out in nature, the spiritual aspects of life. It's also important that we set boundaries and attend to our own needs and emotions. And having our own support network is really important. Looking after ourselves is an important part of being resilient. So I hope this has provided with some practical information, and thank you, everybody.
Well, thank you, Kay, for this very, very interesting presentation, which you show all the different aspects. It's a very nice theoretical part, but also the practical part of what we can do, and it always shows the part of healthcare professionals are there to provide care, but it's also important to have the whole structure around it to be able to continue doing that care. And it was really insightful. Thank you so much. I did look at the Q&A under here, and there are some questions have been answered, but we do encourage listeners to engage with the Q&A session. They will be dealt with at the end of the presentation. But for now, it is my great pleasure to introduce Dr. Luna El-Bizri. She's the founder and manager of Luna Farm Pharmacy and lives in Lebanon. And she will be talking about the practical approaches for supporting mental health in pharmacy settings. Luna, please, the floor is yours.
Thank you very much. Thank you. So today I'm going to talk about how we can support patients with mental health from the view and the eyes of a community pharmacist. So let's see, before going to what are the interventions that we can do, what's going on during conflict, disasters, and wars. Next slide, please. So when we have a disaster or a conflict or a war, the first thing that is happening that people are not able to reach hospitals and clinics. And this is very important, especially for mental health patients, because their treatment, they are going to be the manager of their treatment. And maybe they will continue a treatment that they shouldn't continue. And we can see that they will have some side effects, maybe, and they will have some problems in dosing and others. Another problem that is common during conflicts and wars and disaster is this severe shortage of medicines. Of course, mental health medicines are included. And at that moment, we have to remember that medicines for mental health problems and crises are mood stabilizers, psychotropic, antidepressants, and others that we cannot just stop them abruptly. And they can have some serious side effects. They can have these withdrawal symptoms. They need, maybe patients need hospitalizations, and we have said that they cannot reach a hospital. So it is a critical phase when we are in this point of shortage of medicines. Also, when we are in wars and disasters, the priorities for the families due to the problem of economic weight is different than when we are in peace period, because they care about finding a shelter, paying for their food or other necessity, and for them mental health is no more the priority. And for that, they will stop taking their medications, and we're going to have this problem of withdrawal, side effect, and others. Also, what is important that if we talk about healthcare providers and healthcare workers in conflicts area and disasters, they flee because they are humans after all, and they can go outside this hot zone, red zone, and for this the remaining healthcare workers are scarce, and we can fear, as my colleague Kaya has said, to have this burnout, and they care more about delivering medical care for patients with injuries and others. And if we think also in some areas, the mental health care is not a priority and still stigmatized, we understand that the patients with mental health care problems will have their treatment disrupted. Next slide, please. So what happens after the war and after the conflict? This is a simple table telling you what is happening. These are the first 5 unhappiest countries globally. If we look at their situation, we can see a humanitarian crisis, conflict, post-conflict recovery, health emergencies, political instability, natural disasters, and so on. By the way, my country is number 3 unhappy country in the world. So you do understand that I'm talking generally about these mental health problems. Next slide, please. So if we look at the problems and the psychological and behavioral responses to disaster, I'm not going to talk about resilience. Kay have talked a lot about it. I'm not going to go deep because also Jay has talked about the problems and the psychiatric disorders. But as you can see, we have, besides the psychiatric disorders like depression, post-traumatic syndrome, anxiety, we have distress reaction, for instance, problems in sleeping, insomnia, irritability, problems in concentration, as well as the emerging of new health risk behaviors, such adding, for instance, smoking, alcohol drinking, and others. Next slide, please. So why we are thinking about pharmacists, and in particular community pharmacists? This is the WHO model network of community-based mental health services. And you can see that pharmacists are well positioned because they can collaborate between the Ministry of Public Health, between NGO, civil society, other community partners, and at the same time, they can deliver some of these community-based mental health services, such as daycare, daily care, clinical care, support, make a liaison between other different partners and stakeholders, and delivering some crisis services indeed. So the pharmacists are really and can play a vital role during disasters and war. Next slide, please. Why do we think also about them? Because they are potential first responders for the screening and referral of those requiring professional assistance for mental health crisis. They are easily accessible. They are trusted by the community and their community. And if they are well equipped and trained, they can gap this and make the bridge between the patients who has mental health problems and the access to treatment and support they need. And as my colleagues have said, they have to do it with confidentiality, with a non-judgmental way, showing solidarity and empathy. Next slide, please. So if we want to go really to the real life, what can we, during crisis and disaster, deliver as community pharmacy? We have different interventions that we're going to talk in the next few slides. Medication management, psychoeducation, early identification and referral, and telepharmacy support. Next slide, please. So medication management is one of the old, if we want to put on between two brackets, let's say qualities and knowledge that pharmacists, especially in community, is offering. But this role is really very important for mental health patients, because when you are making a medication review for a patient with medical health problems, we have to take care about dosing, about drug-drug interaction, about not disrupting the treatment. We have to advise them about adverse effects, because as you know, psychotropic medicines, they can have anticholinergic, sedative effects, and we can have some cognitive and physical impairment. And this is highly important for people, a vulnerable population like old people, because we will fear that they will fall and they will hurt themselves. So it is really important to highlight to those patients how they have to take their medications, what to expect, what to do in case they are taking another medications. And what is most importantly is really to explain for them what is the significance of adherence. Because unfortunately, till now, the adherence levels are very poor for patients taking medications for health mental problems. For instance, 50% of patients taking antidepressant, they will stop it prematurely. So it is very important to highlight the importance of adherence when we are talking about medication intended for mental health problems. Next slide, please. The second intervention that is currently done at the level of the community is psychoeducation, because it's not only delivering, dispensing medication for the different psychiatric disorder, but also we have to have a look on the distress reaction that the patient can have post-traumatically, post-war, post-conflict, because as we have said, they will have different change in their pattern sleeps, irritability, and others, and the pharmacists can do a lot in this area. Next slide, please. So what is important along with the non-judgmental way, the empathy and solidarity, it is important to have this collaboration between the pharmacist and the patient, because he will understand what is his disease, what he has to expect, what he has to do to alleviate the stress syndrome. He will have the support to adhere to his medication. Next slide, please. And the role of the pharmacist is not only towards patients. You have to educate community about mental health and trauma, because lots of communities are still looking at mental health problem as a stigma, and people are afraid to seek help and to ask for help. So how about these people that are living in wars, conflicts, and disasters? So you have to encourage the individual to seek help. You have to raise awareness about mental health. And this is very important. And you have to be very clear when you are delivering your information on mental health symptoms and what are the options. And you can see from this study that they have integrated mental health support in the pharmacy practice. And you see in this table that more than 95% of these patients agree or strongly agree that they felt comfortable discussing mental health with pharmacists. They understood their symptoms, so now they will know how to cope better after the consultation. They will recommend pharmacy mental health support. And this is very important, because when you establish a good way of communication, it is encouraging the patients to seek your help. And they felt supported. But what is important, that the pharmacist showed empathy and a non-judgmental attitude. Next slide, please. So what we can do also, we can help these patients with how to deal we can deliver some strategies on how to do if you have insomnia, if you have some stress, some practical, simple way to help them. you have to help also these patients seeking for other support from other healthcare providers, because you are in the center. You can cooperate with the Ministry of Public Health, you can cooperate with other community providers, so you can help these displaced patients, refugees, immigrant, and you can play this role. And finally, you have to raise again a public awareness campaign, be a part of national public awareness campaign, be part of educational workshop, that so you can detect the signs of mental health issues and how you can be part of referring patients to other support services. Next slide, please. The third intervention that can be delivered at the level of the community pharmacy is the early identification and referral. I really encourage you to be trained about psychological first aid. It's not delivering psychotherapy at the level of the pharmacy at all. It is something that you will know and identify the early signs of a mental health problem. And when you can identify these first signs of mental health problem, you can refer the person. If really he needs support from other healthcare providers, you can help them and refer them to the appropriate healthcare services. Next slide, please. So after, during and afterwards and conflicts, you can see what my colleagues have talked about: the psychiatric disorder, depression, post-traumatic syndrome distress, anxieties, and others. Next slide, please. What you can do: use simple, easy scales to identify your patients. For instance, I have put for you two simple toolkits that they can help you: the standardized tools, the generalized anxiety disorder scale, the patient health questionnaire. You can screen your patients for the mental health conditions. Indeed, when you showed this empathy, when you interact with your patient, a study had shown that the outcome are very positive. You will have a reduction in anxiety symptoms, in depression symptoms, in PTSD symptoms, and you improve the medication adherence for these patients. Next slide, please. For instance, in Lebanon, we as pharmacists have helped a lot during the war, the 2024 war, 2023, 2024, because we helped patients to know, even if they are indeed, we refer them and we help them. For instance, our Ministry of Public Health have established a free mental health services in Lebanon. We help our patients to go to these free mental health services and where to find them. We gave our patients, when they are in need, the free hotline to help them. So you, in the middle of all other services or healthcare providers, you can help these patients. Next slide, please. The last intervention that can happen at the level of the community pharmacy is the telepharmacy and telehealth pharmacy as a support. So by definition, what is telepharmacy? Telepharmacy is the provision of pharmaceutical care to patients through the use of telecommunication and information technology when direct face-to-face interaction is limited. Maybe, as Kay have said, you don't have internet anymore, but you can use other telepharmacy services. For instance, you can have the mobile-based application, you can have a telephone-based care, you can have, if you have internet, a video conferencing, mobile web, and other services that can be delivered through this information technology and telecommunication. Next slide, please. I have chosen a study showing what happened during COVID pandemic. And you know, this is, of course, a health emergency for when a community services has used telepharmacy support. And you can see in the consultation content that depression was there among other consultations that were asked by the pharmacist. Next slide, please. If we go deeper and see what was the content, you can see that mainly it was a patient education, talking about the medications, what is the choice, what is the special population, what is the dosage, and other. So as you can see, telepharmacy can help if you can use this technology. So let's see what we can do at the end. Next slide, please. So in conclusion, how can we well prepared as community pharmacists? Because if we are not well prepared, we cannot deliver a proper support for these patients. We have to be well trained, well educated. We have to build our capacities because we have to really detect the early symptoms. Scale up trainings on psychological first aid, training on mental health in the context of emergencies, because when you are during crisis and emergencies, the trauma and the aftermath, the war and conflict is different. You have to master your psychiatric medications and the medication used for mental health, because you know how to do the dosage, what to do if there is a withdrawal symptoms, what are the drug-drug interaction side effects and others. You have to really be well educated about crisis recognition and referral cycles. A second important point, especially with the stigma surrounding mental health, is to have a workplace readiness, because you have to have a private consultation room. You cannot discuss the mental health problems of your patients in front of everyone. Finally, if you can, if it is possible, you have to have a technology integration and to have training on telepharmacy and secure platforms and use of application for adherence and mental health support. Thank you very much.
Thank you, Luna, very much for this very interesting presentation on these practical approaches for supporting mental health as a pharmacist. It shows the important role that pharmacists can have and the sort of resilience that pharmacists have in applying all their knowledge and skills in the various situations. Thank you very, very much. Next in the program are two testimonials from people working in the humanitarian field and two, struck areas. The first testimonial will be from Sudan by Maram Al-Arabi, and these presentations will be done by a video presentation. Please.
Hello, my name is Maram. I'm a pharmacist from Sudan. I currently work at the Federal Ministry of Health and live in Atbara City. It's one of the safest places in Sudan right now, located in the River Nile state in North Sudan. As one of the thousands of Sudanese people, I've been through a lot since April 2023. The war has been the most significant event in my life, affecting me both personally and professionally. While I was working at a hospital alongside the ministry, I had to leave my clinical job because it became inaccessible due to weapons and fighting near my home and hospital and literally everywhere, which affected my ability to provide healthcare services. After being displaced, I had to find a new job to continue my career. But it wasn't that easy. My financial status had changed and I needed a suitable job to meet my needs after the war. However, I couldn't find any opportunities despite applying. But fortunately, I was able to remain attached to the Ministry of Health as a critical staff member. That allowed me to cover my living expenses to some extent. But I still have a missing piece in fulfilling the clinical side of my pharmacy career. Since I worked long hours each day as a critical staff member at the Federal Ministry of Health during war, it was very challenging for me to find another job in the clinical sector. But still, I feel satisfied that I am able to serve my country under such difficult conditions. And at the same time, I consider myself lucky compared to many other Sudanese pharmacists who have lost their workplaces, careers, opportunities, and even their lives. Their voices and stories deserve to be highlighted entitled because they reflect the real challenges and resilience of the pharmacy community in Sudan. My story is just one of a million stories that I hope will be motivation for many of my colleagues worldwide. Thank you.
Well,
Hello.
and thank you so much, Maram, for this testimonial. It shows the resilience that you have and all the difficulties that people are confronted in these situations. And thank you so much for being so positive and taking up strength and wanting to contribute. The next testimonial will be from Gaza by Sharef Al-Shrafi.
السادة الحضور، السلام عليكم ورحمة الله وبركاته. حابة أتشكر أولا دكتور صلاح الإنسان اللي ساهم ولا زال يساهم بنشر معاناتنا وإيصال صوتنا وشرح الواقع المرير اللي نحن بنعيشه. أنا صيدلي شريف شرافي، عضو مجلس نقابة الصيادلة للمحافظات الجنوبية قطاع غزة. ححكي اليوم عن واقع الصيدلي اللي نحن بنعيشه كل يوم بيوم. بعتذر على رداءة الصوت أولا، وبعتذر إذا تسمعوا صوت زنانات أو صوت قصف. هذا واقع نحن بنعيشه كل لحظة بلحظتها. نحن كصيادلة مش مجرد ممارسين للمهنة، نحن أصبحنا شهاد على معاناة شعب غزة، شعب كامل يباد، شعب كامل يعيش مقتلة يومية. نحن الصيادلة خط الدفاع الأول أمام انهيار المنظومة الصحية المحترقة أصلا. وظيفتنا كانت عبارة عن صرف أدوية، تقديم خدمة صيدلانية واستشارات. نحن اليوم منحارب طول الوقت للحفاظ على حياة الناس. ما في دواء. هاي جملة بسيطة بتسمعها لما تروح على صيدلية، بيعتذر لك الصيدلي بقول لك ما في دواء. كلمة كفيلة بأنها تضغط الصيدلي نفسيا، تضغط المريض. الصيدلي حيحس بالعجز لأنه مش قادر يقدم الخدمة اللي مطلوب منه يقدمها، وهالشي بيأثر على حياة المريض إذا كان بحاجة ماسة. طبعا باقي المستلزمات الطبية من المحاليل الوريدية وأدوية هرمونية وإسعافات دورية طبعا هذه شبه مقطوعة بالإضافة للدواء. نحن تحت حصار من 17 سنة خلى رفوف الصيدليات شبه فارغة، وخلال هالحرب زادت الأزمة. تخيل نفسك صيدلي أو بتعمل بالمجال الطبي مش قادر توفر لشخص عزيز كان أو غريب دواء حيكون سبب بإنقاذ حياته. نحن بنحس بالعجز وعدم القدرة على مجاراة الواقع المرير اللي نحن عايشينه كل يوم. أصعب شيء بالمهنة إنك تكون على رأس عملك ويجي لك خبر إصابة حدا من عيلتك أو شخص عزيز عليك. أول شيء أنت ما بتقدر تترك مكانك، ما في حدا حيقدر يسد مكانك أو حيغطي غيابك نظرا للعجز الموجود عندنا بالأفراد والكادر. تعرف قديش عنا صيادلة استشهدوا؟ أكتر من 100 صيدلة وأكتر من 200 إصابة الزملاء. خص بالذكر الدكتور عصام العطار عضو مجلس النقابة، تم قصفه هو وعائلته وابنه أحمد مريض توحد للعلم. أحمد عمره ما أزل شجر ولا حجر وتم قصفه. نحن اليوم نحكي مش عن أزمة صحية وبس، نحن بنحكي عن أزمة إنسانية وأخلاقية وإنسانية ونفسية. نقص الدواء مش مجرد رقم بتقرير، كل حبة دواء معناها حياة. يكفينا إحساس بالعجز. اليوم الصيدليات عبارة عن شوادر، غرفة صغيرة 2 متر ب2 متر، شباك بيطل على الشارع. تخيلها. وما زال زميلنا الصيدلي بيقدم أقصى طاقته في سبيل تقديم خدمة. أكثر من 90% من صيدليات قطاع غزة تم قصفها. رقم كبير بيخلينا عاجزين عن تقديم خدمة صيدلانية. لهيك الزملاء اضطروا لفتح الأكشاك الصيدلانية لمجاراة الواقع اللي نحن عايشينه. بدي أحكي لك تجربة شخصية صارت معي. أنا كنت أملك صيدلية تم قصفها أول مرة، رممتها. تاني مرة تم قصفها، رممتها، لغاية لما تم إنزال المبنى كله. وقتها ما بطل فينا حيل أو قدرة لإعادة الإعمار. أنا تركت صيدليتي، تركت بيتي. تعرف شو يعني تترك بيتك أو صيدليتك؟ أنت تركت وطن. أنت تركت وطن. السادة.
Well, thank you so much, Sharif, for that testimonial. I'm not going to spend a lot of words on it. I think it speaks for itself. It's amazing how people with very, very little left to help people with, the pharmacists are still there to continue to help serve patients. And I think that's one of the deep down things that identifies a pharmacist. So thank you, Maram and Sharif, for those testimonials. Next, it is my great pleasure to invite to the panel discussion Dr. Salah Kandil Shubar. He's the Deputy CEO of Tawreed in Jordan. And so please, all the panelists, could you open up your videos? And we will start by, I was asked, because you have just entered here, Dr. Salah, all this is what we've been hearing. I think it's been a great context from the theoretical part to the emotional part, but also the resilience part that is so important. Let me ask you a question first, because it is so overwhelming. But how can we, as FIP and colleagues across the globe listening to this, support our colleagues, such as the ones that we heard on the testimonials?
First of all, thank you, Rob, and thank you for FIP for this invitation and this webinar, and I appreciate your support for humanitarian work in the world. First, I would like to concentrate in the mental situation of the pharmacist himself, because he is under stress, he is under moral injury, and he is under fatigue, and even he is under survival goal, that he is in the safe. For example, for the pharmacist working in disaster, he is working in, for example, in hospital, his family is not safe. So this is brings emotions about if he is working in the right atmosphere. So, and I believe that we can do with those pharmacists who are our colleagues, that we can have a global helpline for them with mental health organization, and this will serve them as 24/7, and to establish a communication support for them, since we couldn't be physically there, so we can facilitate peer-to-peer support network. And also other organization can supply the digital mental health care resources for those pharmacists who are working in those places. So I believe that we can working in them with them in those projects in order to overcome the problem of mental health they are facing. And the last thing, which is maybe it is difficult and need organization, that we can the financial help or the financial aid to help them to rebuild their career or rebuild their pharmacies or to supply the medicine to Gaza. And we appreciate the initiation of FIP for the campaign of Human too. And this was this is a very important thing to help the patient, and we have to rethink how to help the pharmacist.
Great. Thank you very much. Are any of the other speakers would like to say something about the subject?
Jay, it's really heartbreaking to hear what is going on. And, because of coming from a completely different part of the world, it really, really brings home to us just how severe the situation is. I think that, obviously there are a lot of aid agencies that we can work with, but the concept of telehealth and the concept of us showing our support for these pharmacists and them knowing that, pharmacists everywhere are concerned for their well-being. I mean, obviously that seems like such a small thing that we can do, but it is something we can do. I mean, it's a little bit like, we can't control the circumstances they're in, but we can offer our support in whatever way. And it might be, telehealth or communication in other ways, sort of keeping in touch and offering our personal support for them, and hearing their story and listening to it and acknowledging it.
Yeah, thank you very much. FIP in crisis situations reaches out to local organizations and sees how best they can help. So thank you very much. And I think we can focus on the long term, but I think Vijay also said it was very important. It's not just the acute situation, it's also the longer term effects that are there. And I think it's important because it's I think that's probably a role where pharmacists can play an important role too in the phase of recovery, where suddenly disruptions are becoming, well, not clear, but have to be distinct. And I think is that something, Vijay, you were talking about, that the depression being something that comes actually in a later phase. That's the lagging part that comes along. Is that a role where pharmacists in situations play an important role too?
That's right. So it's not just the immediate. So, in a situation like war, people are just trying to cope day by day. And once, that immediate situation is resolved, it becomes like a recompression, where, that is lifted, and then you start seeing symptoms of depression and PTSD becoming more prevalent. So pharmacists can definitely play a role there, looking at how because pharmacists are the ones who are going to see people coming to them very often for help, or they've got these good relationship with their patients, and they'll come and see the pharmacist more often than see doctors, and and even like Kay and Luna suggested in their talks, where this constant interaction is when people can pick pharmacists can pick these symptoms up.
Luna, would you like to contribute there?
Yeah. I have to tell you from my own experience, because as I have said, Lebanon was in conflict and wars last year. The internally displaced people who came to the safer area, such as in Beirut, where is my community pharmacy, they came, of course, distressed, traumatic, but also they came upset and irritable because they have their own list of medications. They used to have their own community pharmacist who they trust, and they are coming to this new area where they have to build this trust again with the new pharmacist. They have to really trust that the generic, for instance, that we are substituting is the same. They want to trust us to speak up and to talk about their problems. And again, here is the major role of the pharmacist in this area, because you have to listen carefully to what they are saying. And again, this is very important because pharmacists sometimes they don't look at these details. The non-judgmental way is important. The confidentiality and respect of this confidentiality, the empathy, because if they're not going to feel this, they're not going to talk, and they're going to refuse your solutions as substitutions, as referral or others. So this is important to do it when you are receiving these persons.
Yes, and I think it's important that pharmacists, I think it is mentioned often, but especially in this situation, are one of the first people and approachable in the healthcare system. So they can also be sort of the web in the system to refer people to other healthcare professionals. And I think this is the one thing, Kay, that you mentioned too, all the different groups that you're part of. And I loved your resilience comment. Resilience is a leadership skill. And I think that is a skill that you learn or have to learn in an early phase. And it helps you in real life, in normal life, but training that always helps you in later life and in emergency situations to deal with it. So it's far bigger than looking at a humanitarian situation. It is being a pharmacist and being prepared and being resilient and not being overwhelmed by the sudden situation. You can't prepare for it. It is always different, but you can prepare being resilient. And I very much like that about your presentation too. I am looking at the time. We have 3 minutes left. I need about a minute to wrap up. Hearing this, Salah, you've joined us. Are there points that you would like to give as a take-home message?
Yeah, it's very important to take care of pharmacists during crisis or and support them. So I appreciate that we can have something, a guideline for the pharmacist during the humanitarian for humanitarian issues or for during crisis, and to have those networking with the expert people to help them and to support them, because if you support the pharmacist, you will support the patient, and to give them a message as a pharmacist that you are not alone. So this is my message to all pharmacists around the world and who is suffering from crisis, that you are not alone. And I think that this is the message of all pharmacists here in the webinar, and it must be the message of FIP, and I believe it is the current situation. So this is my message to the pharmacist and to the FIP. Thank you.
Great, thank you so much. And indeed, I really would want to emphasize it from the FIP. You are not alone. Do reach out. We will try to reach out, but reach out to us. And there is a huge community with a lot of experts that can help in that situation that you need. It's not about deciding what you need, but it's about asking and collaborating and what is really needed. I do have to go on to the last slides. And this is more because we have 1 minute. Could I have the next one, please? I think resilience, that is the most important thing. Train resilience and be prepared and be there for each other in this community, but also as professionals together. This event will be available online, and other very interesting digital events can be found online too. The next slide, please, is we do come together once a year, and the next one will be in Montreal, Canada, August 30th to September 2026. And it would be wonderful if we could see many of you there and have these discussions that we're having here together in a face-to-face. There are sub-themes and there are important dates for abstract submission are here. They can be found on the website, and we encourage you to be part of the conference. And of course, we would love to have you be part of our global community. It's amazing to see so many attendees. I can't see beyond the 3,000 that are limited to this session. The YouTube attendees are also there. Thank you all for attending. Thank you for being a pharmacist, and thank you for helping the fellow people around you, whether it's on a personal level, on a societal level. Thank you very much. Think health, think